Because chronic diseases and conditions increase with longevity, 80% of older adults have at least one chronic disease and half have two or more diseases. The most common conditions are arthritis and high blood pressure. Anytime you have any change in your health or notice any new symptoms, you should report it to your healthcare provider.
The exciting thing is that we're living longer, we're healthier, we're more active, we're involved, all of those things that are going to contribute to a healthy quality of life as we get older. And it's important not to neglect your own personal health care. Be sure that you find a doctor that understands you, that you feel comfortable with, not only your doctor but your healthcare team, and make sure that you follow through on all of the instructions and advice that you're given. A health issue that's been identified in Georgia is the failure of a lot of older people to have flu shots. I cannot impress upon you the importance of having a flu shot every year. You get a cold, you don't feel well, and it can very quickly turn into something very serious. The minority population in our state is not getting flu shots. We're just not doing it well enough. Every year you should have a flu shot. You should have the pneumonia vaccine. It's a one-time shot, but some doctors will recommend that you have it as soon as 5 years. Others may say 10 to 15 years, but you should have a pneumonia shot on the recommendation of your healthcare provider. A new vaccine that has been introduced this last year is the shingles vaccine. And for any of you who have friends or know of people who have shingles, it's very painful. It's not anything that any of us want, and it may be recommended by your healthcare provider that you have this also. Overall, I think it's important that you have foot care if you've identified corns, calluses, bunions, if you notice that when you put your toe into the warm water or if you just step one foot in front of the other, you notice that you're not feeling things. It could be an early sign of a neuropathy, and a neuropathy is just some nerve weakness in your feet, and this could be a problem. You could fall more easily, you could suffer other injuries and not be aware of it. So I think that you should see a podiatrist on a regular basis if you notice anything wrong with your feet. Your skin care is very important. A lot of older people develop marks on their face and on their arms and legs, and if you don't go to the dermatologist, you're not going to be able to identify a possible cancer.
Older people lose interest in and the capacity for sexual relations.
That's probably true. Because you probably lose desire and it'd be less appealing.
No. I hope not. No, I don't think so.
No. False. I don't lose interest in it. I find my wife still just as attractive as she always was, and therefore I go at it.
False. I think you could have an active sex life throughout your whole entire life, and just depends on your physical condition and how you generally feel if you have a loving mate. So I would say false.
The truth is, more than 70% of those 65 and older continue to be sexually active. Older adults who are not sexually active often do not have a partner, are on medications that inhibit their sexual drive or abilities, or they may have significant health problems. As older adults live longer and may have new partners as they age, it is important to recognize that there is a need to use protection in order to avoid sexually transmitted diseases.